friends, today I am going to talk about the disease acute mountain sickness. Let's see about what is acute mountain sickness. Acute mountain sickness is a headache with other symptoms including nausea, vomiting, loss of appetite, fatigue or malaise, sleep disturbances, and dizziness or lightheadedness. Altitude sickness is the term for the medical condition that happens when you move to an higher altitude too quickly. The higher up you go, the thinner the atmosphere gets. That means breathing in the same amount of air gets you less oxygen that at the lower altitude. Altitude sickness happens when your body has trouble adjusting to the difference in how much oxygen you are getting with each breath. Types of this condition. Altitude sickness can refer to three distinct conditions. Acute mountain sickness. This is the mildest and most common form of altitude sickness, also called as AMS in abbreviation. High altitude pulmonary edema, HAPE. This is when altitude sickness affects your lungs, causing them to fill with fluid. It is a medical emergency that needs immediate medical attention. While not the most severe form, it can cause death even faster than the others. High altitude cerebral edema, HACE, is the most severe form of altitude sickness and happens where there is a fluid in the brain. It's too the life threatening and you need to seek medical attention right away. How common is altitude sickness? Altitude sickness is common among the people who are in acclimated. Almost everyone who ascends quickly to 11,000 feet will develop acute mountain sickness. Symptoms and causes. Altitude sickness can cause many symptoms, and this can vary depending upon the severity. The symptoms of acute mountain sickness usually appear on the first day or so reaching a high altitude. More severe forms like HAPE or HACE take longer to appear, usually between 2 or 5 days. Symptoms include headache, nausea and vomiting, loss of appetite, fatigue even when resting, malaise, trouble sleeping, dizziness or lightheadedness, vision changes, blood vessels ruptures in your retinas. What causes altitude sickness? Given time, your body can usually adapt to altitude related changes that affect how much oxygen you get with each breath. Without enough time to adapt, altitude sickness is the result. Risk factors for altitude sickness. The risk factors for altitude sickness often related to altitude itself or how you get there. Symptoms and causes. Higher altitude. The higher you go, the greater your risk for altitude sickness. Speed of ascent. Getting to a higher altitude quickly increases your risk of developing altitude sickness. People who fly to high altitudes rather than walk, hike, or drive are much more likely to develop it. Above 8,000 feet, you should descend no more than 1,640 feet. Alcohol and drugs. Drinking alcohol or using certain medications, especially sedatives, can greatly increase the chances of developing higher altitude sickness. Is history of altitude sickness. Having any form of altitude sickness, especially the more severe form like HAPE or HACE, increases your risk of having it in the future. A common misconception is that your physical health is a risk factor for developing altitude sickness. It isn't. Example including anemia or chronic obstructive pulmonary disease. Complications of altitude sickness. Altitude sickness can be deadly if AMS turns into HAPE or HACE. HAPE can be deadly within 12 hours and HACE can be deadly within 24 hours. That's why recognizing altitude sickness of any kind is critical to preventing of severe complications. Diagnosis and test. A healthcare provider checks your breathing, blood pressure and heart rate. They may check if you have any signs of more conditions like HAPE or HACE. Test to diagnose altitude sickness. Altitude sickness often happens in the locations that are remote and don't have readily available medical equipment. By the time you go, you descend to lower elevations where you can receive more advanced medical care. Your symptoms are improved or gone entirely. X-rays. This can check your lungs for the signs of HAPE which causes fluid to fill in your lungs. Electrocardiogram (ECG). This can rule out other conditions like a heart attack. Some symptoms of altitude sickness are similar to heart attack symptoms, so an ECG may be necessary to rule out a heart attack. Magnetic resonance imaging (MRI) scans. This can look for signs of swelling in your brain. MRI scans can also sometimes detect longer lasting changes left behind by altitude sickness you had in the past. How is altitude sickness treated, and is there a cure? There is only one way to cure altitude sickness outright: descend to a lower altitude. Several treatments can help altitude sickness when it's not as severe. Some of these are also helpful when an immediate descent isn't possible. Treatment approaches include: stop and acclimate. Stop and resting is a good idea at first sign of altitude sickness. Descent. If symptoms are more severe, such as dizziness, fatigue, or nausea, are getting worse, descending is the top priority. Most experts recommend descending until the symptom gets better. This usually involves a decrease of at least 984 feet and as much as 3,281 feet. Supplemental oxygen. Breathing higher concentrations of oxygen can help to offset some of the symptoms of altitude sickness. Medications. Certain medications, especially acetazolamide, dexamethasone, or nifedipine, can treat altitude sickness and delay more severe symptoms or complications. Dexamethasone and nifedipine are generally reserved for moderate or worse altitude sickness. Hyperbaric therapy. This is similar to treating a scuba diver with decompression sickness. At higher altitudes, hyperbaric therapy is possible with portable hyperbaric bags. This can delay the worsening of symptoms until it's possible to evacuate a person to a lower altitude. If you want more information, please like, share, and subscribe to my channel. Thank you.